Good evening, and thank you very much for joining with me. Let me begin by stating that the so-called health care bill passed in the House several months ago, strongly supported by President Trump, is the most anti-working class legislation that I have ever seen. And the Senate bill, also supported by Trump, in some respects is even worse. At a time when working families are struggling to survive, when many people are working longer hours for lower wages, when people are forced to work 2 or 3 jobs just to bring in enough income to keep the family going, this legislation, this Republican legislation, will cause devastating harm to millions of people from one end of our country to the other. And there is one very simple point that has to be made, and that is, together, we will not allow 22 million Americans to be thrown off of the health insurance they currently have in order to give over $500 billion in tax breaks to the wealthiest 2% of this country and to profitable drug companies, insurance companies, and other large corporations. We will not support a bill which takes from the most vulnerable people in our country, the children, the elderly, the disabled, the sick, and the poor, in order to make the very, very rich even richer. That is unconscionable, that is un-American, and we will not accept that. Plainly stated, this so-called health care bill today, as currently written, is nothing more than an enormous transfer of wealth from the working class of this country to the very rich. While this bill contains massive cuts to Medicaid, $800 billion over a 10-year period, while seniors will pay far more in premiums, while Planned Parenthood will be defunded, and 2.5 million women will lose access to the health care that they want. While all that happens, the 400 highest income taxpayers, most of whom are billionaires, will get about $33 billion in tax cuts. That, my friends, is nuts. Now, not only is this bill a disaster for the American people, but the secretive backroom process by which it has been written is unprecedented and literally beyond belief. Think about it for a moment. This bill impacts 1/6 of our economy, 1/6 of our economy, over $3 trillion each and every year. And this legislation, healthcare, touches upon virtually every person in America. Yet the discussions and negotiations on this legislation have never been made public. Everything has been done behind closed doors. It's not just that Democrats have not been involved in the negotiations. The American people have not a clue what's going on. It's all done behind closed doors. Unbelievably, with legislation that would completely revamp our healthcare system, there have been no doctors, no nurses, no hospital administrators, no representatives of senior citizen groups, no one knowledgeable about the opioid crisis, which is impacting our country from coast to coast. Not one person, not one expert in healthcare has been able to testify and speak out about how this legislation will impact our country. How, in God's name, can you draft a bill of such enormous magnitude without hearing one public comment from the experts in our country who are most knowledgeable about healthcare? How can you move forward without one public hearing? And I should tell you that this concern has been raised not only by Bernie Sanders and people in the Democratic caucus, but by a number of Republicans as well. Now, I know that there are some people out there who will say, well, you know, Bernie Sanders is a strong progressive. Of course he will be opposed to this Republican bill. What I want you all to understand is that it is not just Bernie Sanders who opposes this disastrous legislation. It is virtually every major healthcare organization in this country, some of whom are pretty conservative, who oppose this terrible bill. It is the AARP, largest senior group in America, that opposes this legislation. It is the American Medical Association. Those are the doctors that we go to, you know. It's the American Hospital Association, because they worry very much about the impact of this legislation on hospitals, especially rural hospitals. It's the American Cancer Society, the American Heart Association, the American Academy of Family Physicians, the American Academy of Pediatrics, the American Psychiatric Association, the Federation of American Hospitals, the Catholic Health Association, the American Lung Association, the Cystic Fibrosis Foundation, the March of Dimes, the National MS Society, and the American Nurses Associations. Those are just some of the major national organizations who oppose this horrific legislation. Now, several months ago, as you all know, with the strong support of President Trump, the House passed their disastrous health care bill, while the Senate bill is very similar. It is even worse in some respects. So let me just tell you what the House bill does. This is the bill that has already been passed. Today, 28 million Americans have no health insurance, and millions more are underinsured with high deductibles and co-payments. Despite that, what this bill does is throw another 23 million Americans off of the health insurance they currently have. So instead of reducing the number of Americans without health care, it almost doubles the number of uninsured in this country. Now, everybody knows that seniors are struggling, older workers are struggling. What this bill does is significantly raise premiums for older workers. In some cases, actually doubles it. What this bill does is cut Medicaid by $800 billion. You know what that means? It's not only insurance for low-income children and low-income people. Almost 2/3 of all funding for nursing homes comes from Medicaid. What happens when you slash Medicaid? What happens to the older people? People with disabilities who today are in nursing homes? Well, that's something that the Republicans don't want you to be thinking about, but it's true. Now, here's the point. I think everybody understands that the Affordable Care Act, so-called Obamacare, is far from perfect. No one argues that. Premiums in my state of Vermont, throughout this country, are much too high. Deductibles are too high, co-payments are too high, and too many Americans remain uninsured or underinsured. But in each and every one of these very legitimate concerns, the Republican legislation that has been brought forward would only make a bad situation much, much worse. What our job is now, and what the American people want us to do right now, is to improve the Affordable Care Act, not destroy it. Our job is to lower deductibles, to lower co-payments, and lower the outrageously high cost of prescription drugs. We pay, by far, highest prices in the world for prescription drugs. Those have got to be lowered. Further, instead of throwing 23 million Americans off of health insurance, we should be fighting to join the rest of the industrialized world and guarantee health care to all people as a right and not a privilege. And in order to accomplish that, as soon as we defeat this terrible Republican proposal, I will be introducing a Medicare for All single-payer program, which will do just that. And I look forward to working with you on that project. I think there are millions of people now who understand that there's something wrong in our country when we pay far, far more per capita for health care than any other country, when we end up paying by far the highest prices in the world for prescription drugs, and yet at the end of all that, our health care outcomes are worse in many respects than other countries. So there's a lot to be done. Task number one, we have got to defeat this terrible, terrible bill. Point number two, we've got to make some improvements in it, do the best that we can to address its problems. Point number three, as soon as this whole business is over, let us go forward and make certain that the United States of America does what every other country in the industrialized world does, guarantee health care to every man, woman, and child as a right, not a privilege. Thank you all very much.